So I'm often asked by patients how I got into lipografting or fat grafting of the face. And I learned about this very early in my career after my training. I was at a meeting and there was a French plastic surgeon there talking about injecting fat for volume loss. And volume loss was never taught to us in aesthetic training, in residency or fellowship. So it made a lot of sense to me that people lose volume. Our faces shrink, the bones shrink, the soft tissue shrinks overall. So I actually visited him for about a week in France and learned his technique of injecting fat in the face, harvesting fat and then injecting it. And there are different techniques that are used for this. This is over 20, I think it was 28 years ago. So I've been doing this for a long time. I started doing my own little technique. I developed nuances that I have that work. I've done this procedure at least 10,000 patients in my whole career. It works for rejuvenating the entire face and creating a softer look using live fat cells. It works for the under eye dark circles. I use it with almost every facelift that I perform because stretching a face only on a flatter skeleton and when patients have volume loss creates sort of an unnatural look because you're stretching the skin and you're creating just a linear lift where you want a contour, you want a little bit of a softness to the face. So aesthetically, patients look much better. I've got results of patients where fat lasts well over 15 years. Now, not all the fat survives, but a good percentage of it does. So certain areas that are not as mobile, like the temple, the mandible, the under eye area, the fat retention is much higher than, say, the lip area where the retention is not very high because the area is mobile. But overall, fat goes through a process where it diminishes over the course of like 3 to 5 months. Your blood supply nourishes the microfat, the fat cells, and then fat replenishes. There's a stem cell effect with fat, and fat is living permanent tissue, and it creates just a very natural look. I use it in almost every surgery that I perform, and it's been like the cornerstone of my practice throughout my career.